was born so early that his lungs had not fully developed. He had a heart valve that hadn't closed. He needed to have double hernia surgery. He had jaundice. And these things individually are going to be challenging enough, but then you put them all together and a little 2-pound baby desperately trying to breathe on his own is where the real struggle comes in.
Right now, we don't have the ability to deliver these critically ill infants on site and provide the care that they need.
Currently, babies are delivered in outlying hospitals and are transported into Children's for Care. For those tiny, fragile babies, even a short transport can provide risk.
I remember he had been on the ventilator and it wasn't working anymore. And they took him off the ventilator and literally I could not move. I just literally slid down this hall wall. And it was just one of those days that I thought, oh my goodness, is this how this is going to end?
The important thing is that these infants are born in a setting where they have the specialists around them, the people who've been anticipating their birth and who have a plan in mind and who are ready to act.
We've partnered with Alegent Creighton Health to provide the best of their maternal expertise and combine it with the best of our pediatric expertise in one unique service.
It allows all of the team members to meet the mother, the father, explain the whole process to them, because fear comes from the unknown. And the more that you can educate a family, the more comfortable they'll be with the situation and hopefully alleviating fears.
We are now constructing a very large operating suite that is virtually 2 operating rooms joined together by a glass dividing wall. And you can have the mother on one side having a cesarean section and delivering the baby, and the other medical team taking care of the baby on the other side, right where the parents can see what's going on and be a part of what's going on. We'll have all the subspecialists in one place together, talking to the family about each aspect of that baby's care.
Children's recognizes its obligation to come up with a plan for every child to have a better chance to survive.
I know the expertise of our team. I know how much all these people care, and I can't imagine these very high-risk pregnancies going anywhere else.
If anything bad happens, you've got this safety net of experience. It's not one where the doctors will go, yeah, we haven't seen this. They have seen it.
Without this center, moms and babies would be separated from each other immediately after delivery, which isn't a good solution for either one.
I could not fathom being at another hospital, knowing that my baby's yet at another hospital, and I'm not even capable of being there for a couple of days.
These babies have inspired me for years. You look at these tiny, fragile creatures and you think about maybe how weak they are, but I know after 30 years that these are some of the strongest people you've ever seen. And the reason these babies get through all this with our help is because they're strong. They're fighters.
There's no question at all that for some children, being able to be delivered in this kind of a setting is going to be the difference between life and death. And this is what this group of children needs.